Hello, welcome to the fourth video for Unit 5, Mental and Physical Health. This video will be focusing on anxiety disorders, obsessive-compulsive and related disorders, and trauma and stress-related disorders. By the end of this video, you should be able to answer the following three questions. What are the symptoms and distinguishing characteristics of various anxiety disorders, such as phobias, panic disorder, social anxiety disorder, and generalized anxiety disorder? What are the potential causes of anxiety disorders, obsessive-compulsive disorders, and trauma and stressor-related disorders from psychological and biological perspectives? And how do trauma and stressor-related disorders develop, and what symptoms differentiate them from anxiety and obsessive-compulsive disorders? So we are going to start this video by talking about anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive fear, worry, or apprehension that can interfere with your daily life. Anxiety disorders are among the most common mental health issues in the United States. According to the Anxiety and Depression Association of America, nearly 40 million American adults, or approximately 18% of the population, experience an anxiety disorder in any given year. The development of anxiety disorders can be influenced by a variety of factors, including biological factors, like genetics can play a role. A family history of anxiety disorders may increase your risk. Additionally, imbalances in brain chemistry, like neurotransmitter GABA, may have been linked to anxiety. Medical conditions, like certain medical issues such as thyroid problems, respiratory diseases, or cardiovascular conditions, metabolic disorders, and neurological disorders can manifest symptoms similar to anxiety disorders. And there are environmental factors like stressful or traumatic events, such as the loss of a loved one, abuse, or prolonged stress can also trigger anxiety disorders. So we're going to talk first about generalized anxiety disorder. Generalized anxiety disorder, or GAD, is prolonged, vague, unexplained, but intense fears that do not seem to be attached to a particular object. Studies show that between 4.1 and 6.6% of the population have experienced GAD throughout their life. This is more common among women than in men, and it tends to become evident between the late teens and early 20s. One of the things that you need to be diagnosed with generalized anxiety disorder is excessive anxiety and worry occurring for at least 6 months, and that worry shouldn't be contained to a particular topic. You also should have the inability to control the anxiety or worry, and it needs to create a considerable distress or impairment in your social, occupational, or other important areas of your life. You also have to have 3 or more of the following symptoms in order to be diagnosed: restlessness, being easily fatigued, difficulty concentrating or your mind goes blank, irritability, muscle tension, or sleep disturbances. Panic disorder is an anxiety disorder characterized by recurrent, unexpected panic attacks that are associated with persistent concern about having another attack, worry about the possible consequences of the attacks, significant change in behavior related to the attacks, or a combination of any of or all of these. Indicators of panic disorder are similar to GAD, except that they usually are greatly magnified and usually have a sudden onset. This is more common in women and younger people. Some of the clinical features or symptoms are recurrent, unexpected panic attacks that last 1 month or persistent concern over having them again. Some symptoms of a panic attack include shortness of breath or feeling smothered, dizziness, unsteadiness, or faintness, trembling, shaking, or sweating, racing heart, choking, nausea, or stomach pain, numbness or tingling, chest pain or discomfort, a sense of feeling strange, or a fear of going crazy or losing your control or dying. Many of these symptoms actually manifest similar to a heart attack. So people who are experiencing a panic attack for the first time may visit the ER because they feel like they're having a heart attack. The next disorder we're going to talk about is specific phobias. People with phobias know exactly what they are afraid of, and this is what makes it different from generalized anxiety disorder. This is the persistent and irrational fear of an object or situation that disrupts behavior. These fears, however, seem out of proportion with reality, and they seem inexplicable and are beyond voluntary control. Two specific phobias that you should know are acrophobia, which is the fear of heights, and arachnophobia, which is the fear of spiders. Some other specific phobias to know are social anxiety disorder, or also known as social phobia. Social anxiety disorder is an anxiety disorder that is characterized by extreme or persistent social anxiety or performance anxiety, and that causes significant distress or prevents participation in social activities. The feared situation is most often avoided altogether, or else it's endured with marked discomfort or dread. So a person with social phobia is most often going to stay home from any sort of social events. Agoraphobia is the fear of being in situations where an escape might be difficult or help might not be available if a panic attack occurs. So social phobia and agoraphobia are both anxiety disorders, but they differ in their focus and their triggers. So social phobia is the intense fear of the social situation. People with social anxiety often avoid public speaking, social gatherings, or interactions with strangers. Agoraphobia, on the other hand, is the fear of the situation itself or being in a situation and not able to escape if you're having a panic attack. So this can be a fear of crowded places, crowded areas, public transportation, or being outside alone. Unlike social anxiety, agoraphobia is more about the fear of physical discomfort or being trapped rather than social judgment. While both can involve avoidance behaviors, social phobia is rooted in social fears, whereas agoraphobia is more about fear of being unable to escape or get help in distressing situations. Next, let's talk about culture-bound anxiety. Culture-bound anxiety refers to specific forms of anxiety disorders that emerge within particular cultural or ethnic groups. These disorders often manifest through unique symptoms that are shaped by cultural beliefs, traditions, and social norms, making them distinct from the typical presentations of anxiety seen in other cultures. In some cultures, anxiety isn't just an internal feeling of unease, but can be expressed through physical symptoms or social behaviors that reflect cultural values. For example, ataque de nervios, or attack of nerves, is commonly observed among Latinx populations, especially in Caribbean communities. The disorder is characterized by a sudden onset of intense emotional distress, which can include symptoms like crying, trembling, and a sensation of losing control. Individuals may also experience physical symptoms such as dizziness or chest pain, and may often feel as though they are about to faint or die. The disorder is often triggered by stressful events such as family conflicts or significant life changes, and is typically expressed in a highly communal context, meaning it often happens in front of family members. Taijin Kyofusho is a disorder found predominantly in Japan. It is marked by an intense fear of offending others through one's body odor, appearance, or actions. Individuals with this condition experience overwhelming anxiety about how others perceive them in social situations. This fear can be so intense that it leads to avoidance of social interactions altogether. Unlike more typical anxiety disorders, this disorder is closely tied to social harmony, which is highly valued in Japanese or collectivist cultures. The anxiety stems from the belief that one's behavior or physical presence might cause embarrassment or discomfort to others, especially their family. Next, let's talk about obsessive-compulsive and related disorders. Obsessive-compulsive and related disorders involve persistent thoughts and repetitive behaviors that can significantly impact your daily life. At the core of these conditions are obsessions, or intrusive, unwanted thoughts, and compulsions, which are repetitive actions performed to reduce the anxiety caused by those thoughts. This creates a cycle. The obsession triggers anxiety, leading to a compulsion in an attempt to relieve it, but the relief is temporary. Over time, the cycle can intensify, making it difficult for individuals to break free from these patterns and live a normal life. So the first disorder is obsessive-compulsive disorder, or OCD. This is a mental health condition characterized by those persistent unwanted thoughts, obsessions, and repetitive behaviors, compulsions, and it's aimed at reducing the anxiety caused by those thoughts. People with OCD often experience intense distress due to their obsessions, which may include fears of contamination, harming others, or fears of making mistakes. To relieve the anxiety, they engage in compulsions, such as washing, checking, or repeating actions. But the relief is temporary, leading to a constant cycle. In the US, OCD affects about 1 to 2% of the population, with symptoms typically starting in childhood or early adulthood. The disorder can interfere with daily activities and cause significant distress in a person's life. OCD is treatable with therapies like cognitive behavioral therapy and medications such as SSRIs, helping individuals manage this condition. OCD is more than just occasional habits. OCD is not about keeping your pens in rainbow order or making sure all your soup cans are labeled correctly. It's a cycle that can be disruptive, but with the right treatment, people can learn to manage it effectively. Now let's talk about some disorders that are related to OCD. First, we have body dysmorphic disorder, or BDD. This condition involves a preoccupation with an imagined or exaggerated defect in one's appearance. Individuals with BDD strongly believe in a flaw that may not be noticeable to others, causing distress. For example, a person might look in the mirror and think that they are much, much heavier than they actually are, or think that their nose is much bigger than it actually is. People with BDD will sometimes exhibit other symptoms of feeding or eating disorders in order to fix the problem that they see with their body. Next is hoarding disorder. This is characterized by persistent difficulty in discarding or parting with possessions, regardless of their actual value. People with this disorder feel a strong need to save items and experience significant distress at the thought of getting rid of them. These items can be garbage or a collection of particular items. It really doesn't matter, but the person wants to keep those items to avoid the thought of getting rid of it. Next, there's trichotillomania. This is also known as hair pulling disorder. Those affected by this disorder feel recurrent, irresistible urges to pull out hair from their scalp, eyebrows, or other areas of the body, even when they try to stop. People with this disorder will often save parts or all of the hair that they pull out of their body. Lastly, we have excoriation disorder, commonly referred to as skin picking disorder. This involves repetitive picking at one's own skin, leading to lesions and significant disruption in your daily life. Next, let's move on to trauma and stress-related disorders. These are a group of mental health conditions that develop in response to distressing or traumatic experiences. These disorders can affect how a person thinks, feels, and behaves, often leading to significant emotional and physical symptoms. They might arise from events such as accidents, natural disasters, abuse, or prolonged stress. While everybody's response to trauma is different, these disorders can impact daily life and overall well-being. The most common stress-related disorder is post-traumatic stress disorder, or PTSD. This is a mental health condition that can develop after experiencing or witnessing a life-threatening event. It affects thoughts, emotions, and behaviors, often disrupting daily life. PTSD symptoms fall into 4 main categories: intrusive memories, avoidance, negative mood changes, and heightened arousal. One common symptom is flashbacks, which are vivid, involuntary re-experiences of the traumatic event. These can feel so real that the person may believe they are reliving the trauma. Flashbacks are not just nightmares. The person can often experience flashbacks when they are awake throughout everyday life. Another symptom is hypervigilance, which refers to an increased state of alertness and sensitivity to potential threats. A person may constantly scan their environment for danger, even in safe situations, which leads to exhaustion and stress. This may also lead to insomnia. Many individuals with PTSD may also experience hostility, which can manifest in irritability, anger, or difficulty controlling their emotions. This often results from the emotional toll of the trauma and can impact our relationships. Insomnia is another frequent symptom, like I talked about before. Insomnia makes it difficult for individuals with PTSD to fall or stay asleep. Disturbing dreams, anxiety, and hyperarousal contribute to sleep problems, which can further worsen stress and emotional regulation. Lastly, PTSD can cause emotional detachment, where a person feels disconnected from their own emotions and relationships. They may struggle to express or feel emotions like joy or love, leading to isolation and difficulty maintaining close bonds. Approximately 6 to 7% of people will experience PTSD at some point in their lives, with around 3 to 4% affected every given year. Women are about twice as likely as men to develop PTSD, with a lifetime prevalence of around 10 to 12% compared to 5 to 6% in men. This is partly due to differences in trauma exposure, such as higher rates of interpersonal violence. PTSD rates are significantly higher in populations with frequent exposure to trauma. Among veterans, prevalence can range from 10 to 30% depending on combat exposure. First responders, such as police officers and firefighters, also experience higher rates of PTSD compared to the general population. Rates of PTSD are higher in regions affected by war, natural disasters, and other large-scale traumatic events. Now let's talk about the causes of anxiety and related disorders. They can be understood through different psychological perspectives. Let's first look at the behavioral perspective. This approach suggests that anxiety disorders develop through classical conditioning and operant conditioning. For example, someone who experiences panic in crowds may start avoiding public places, reinforcing their fear. Modeling can also contribute to anxiety development. The cognitive perspective focuses on thought patterns that contribute to anxiety. Individuals with anxiety disorders often have irrational beliefs, excessive worry, and catastrophic thinking. They may also experience attentional biases, meaning they focus more on threats in their environment, which increases fear and anxiety overall. Finally, the biological perspective highlights the role of genetics, brain structure, and neurotransmitters. Anxiety disorders may run in families, and an overactive amygdala can make individuals more sensitive to perceived threats. Imbalances in neurotransmitters like serotonin, dopamine, and GABA also contribute to heightened anxiety responses. Each of these perspectives provides valuable insight into the cause of anxiety, and most modern treatments integrate elements from all three of these approaches for a comprehensive understanding and intervention.